Next question. Dash identifies specific relationship between a student's behavior and the circumstances that trigger those behaviors, especially those that impede a child's ability to learn. Functional behavioral assessment, parents, intelligence tests, or observation. Correct answer is functional behavior assessment. Next question is mnemonic strategies help students learn and retain information. Mnemonic strategies include which of the following? Keyword strategies, pegword strategies, letter strategies, or all of these? Correct answer is all of these. Next question is goals for promoting friendship should include trustworthiness and loyalty, conflict resolution, general friendship skills, positive interaction, and dash. Conversation style, taking the perspective of others, responding appropriately, using appropriate introduction. Correct answer is taking the perspective of others. Next question is social stories are written by educators, parents, or students and describe dash social cues and appropriate responses to those cues. Conversation style, conflict resolution techniques, social situations using appropriate introduction. Correct answer is social situations. Next question is dash is a proactive problem solving and database based approach to improving appropriate behavior and achieving important academic, social, and communication outcomes. Positive behavior support, conflict resolution, problem based learning, or social stories. The correct answer is positive behavior support. Next question is positive behavior support seeks to tailor students' environment to their dash, strengths, and needs, differences, preferences, family structure, or cultural background. Correct answer is preferences. Universal sport, group sport, and individual sport are three components of which of the following? IAP, ITP, individual positive behavior sport, school-wide positive behavior sport. Correct answer is school-wide positive behavior sport. Next question is a student who has limited strength, vitality, or alertness due to chronic or acute health problems that adversely affect the child's educational performance would receive special education services under which disability category? Learning disabled, ADHD, other health impaired, or developmental delayed? Correct answer is other health impaired. A persistent pattern of inattention and or hyperactivity impulsivity that is more frequently displayed and severe than is typically observed in individuals at a comparable level of development is considered which of the following? Learning disabled, ADHD, other health impaired, or developmentally delayed? Correct answer is ADHD. Next question is, according to American Psychiatric Association, a student must manifest symptoms of ADHD before age dash and the symptoms must persist for at least dash months. 7, 6, 5, 2, 2, 5 or 10, 6. Correct is 7, 6. Next question is, approximately dash as many boys as girls have ADHD. 5, 10, 3 or ADHD is more prevalent in girls. Correct answer is 3. Next question is, approximately dash percent of the children who are diagnosed with ADHD during early childhood years continue to have the diagnosis in their adolescence. 10, 20, 50 or 70. Correct answer is 70. 3 subtypes of ADHD are predominantly inattentive type, predominantly hyperimpulsive type, and dash combined, adult onset, child onset, or educational. Correct one is combined. Failing to give close attention to details, having difficulty sustaining attention, not listening when spoken to, having difficulty organizing tasks, and being forgetful are characteristics of which of the following? Hyperactivity, impulsivity, inattention, or misbehavior. Correct answer is inattention. Next question. Fidgeting with hands or feet, leaning the seat, running or climbing excessively, and talking excessively are characteristics of which of the following? Hyperactivity, impulsivity, inattention, or misbehavior. Correct answer is hyperactivity. Next question. Blurting out answers, difficulty awaiting turn, interrupting or intruding on others are characteristics of which of the following? Hyperactivity, impulsivity, inattention, or misbehavior. Correct answer is impulsivity. Next question is, for students who are inattentive type of ADHD, teachers should make sure students have enough time to shift from one activity to another, allow flexible limits for finishing work, simplify tasks that have multiple steps, and dash take medication, receive special education services, teach organizational skills, have a peer tutor. Correct is teach organizational skills. Next question is, executive functioning includes which of the following? Processing information to make decisions, taking actions, solving problems, or all of these? Correct answer is all of these. Next question is, non-verbal memory, internalization of speech, self-regulation of affect, motivation and arousal, and reconstitution are types of dash executive functioning, memory techniques, organizational skills, or language skills. Correct answer is executive functioning. Next question is, research related to the academic achievement of students with ADHD reveals which of the following? 80% are mentally retarded, 10 to 40% have learning disabilities, they are more likely to stay in school than the classmates, there are no differences in academic achievement of students with ADHD? Correct answer is 10 to 40% have a learning disability. Next question is, students with ADHD have which of the following challenges? Behavioral, social, emotional, or all of these? Correct answer is all of these. Next question is, genetic factors cause ADHD in about that percent of the children and youth who experience it. 20, 50, 80, or 100? Correct answer is 80. Biological causes of ADHD include which of the following? Prenatal factors, perinatal factors, postnatal factors, or all of these? Answer is all of these. Next question, does the student have ADHD and can evaluators rule out other disabilities? What should the student's IEP contain? And do other disabilities exist simultaneously, or questions that should be asked during which of the following? School entrance interviews, non-discriminatory evaluation, doctor's visits, or teacher's assessment? Answer is non-discriminatory evaluation. Next question is, a determination of ADHD can be made by which of the following? Parents, students, teachers, or physicians? Correct answer is physicians. Arranging the classroom to maximize predictability, avoid distractions, posting daily or weekly schedules, and arranging for smooth transitions are suggestions for minimizing the disruptions related to which of the following? Inattention, behavior, hyperactivity, impulsivity, or instruction? Correct answer is hyperactivity dash impulsivity. Next question is, teaching students to use inner speech, self-talk to modify underlying cognitions that affect overt behavior is called dash. Psychotherapy, cognitive behavioral therapy, instructional behavioral therapy, ADHD therapy. Correct answer is cognitive behavioral therapy. Which of the following is an example of a specific learning disability? Mental retardation, dyslexia, ADHD, autistic spectrum disorder? Correct answer is dyslexia. Which of the following is an example of an intellectual disability? Dyslexia, ADHD, mental retardation, autistic spectrum disorder? Answer is mental retardation. Next question is, an example of a developmental disorder is dyslexia, ADHD, mental retardation, or autistic spectrum disorder? Autistic spectrum disorder. Next question is, in learning disabilities, the name for mathematical disorder is dyspraxia, dyslexia, dyscalculia, dysphasia? Answer is dyscalculia. Which of the following may occur in expressive language disorder? Limited amount of speech, difficulty learning new words, difficulty finding the right word, all of these? Correct answer is all of the above. Next question is, which of the following is not a physical cause often associated with phonological disorder? A hearing impairment, cleft palate, small frontal lobes, or cerebral palsy? Correct answer is small frontal lobes. Which of the following is the percentage of preschool children who are diagnosed with phonological disorder of unknown origin. 4%, 5%, 6%, or 3%. Correct answer is 3%. Which of the following criteria can be used to define intellectual disabilities? Significantly below average intellectual functioning, impairments in adaptive functioning generally. These deficits should be manifest before the age of 18 years, all of the above. Correct answer is all of the above. In DSM-4 TR, intellectual disabilities are divided into a number of degrees of severity depending primarily on the range of IQ scores provided by the sufferer. One of these is mild mental retardation corresponding to an IQ score between 60-65 to 80, 45-55 to 60, 50-55 to 70, or 70-75 to 90. Correct answer is 50-55 to 70. In DSM-4 TR, intellectual disabilities are divided into a number of degrees of severity, depending primarily on the range of IQ scores provided by the sufferer. One of these is moderate mental retardation, represented by an IQ score between 60-65 to 70-75, 35-40 to 50-55, 80-85 to 90-95, or 20-25 to 30-35. Correct answer is 30-40 to 50-55. Next question is in DSM-4 TR, intellectual disabilities are divided into a number of degrees of severity depending primarily on the range of IQ scores provided by the sufferer. One of these is severe mental retardation represented by an IQ score between 5-10 to 15-20, 30-35 to 45-50, 10-15 to 20-25, or 20-25 to 35-40. Correct answer is 20-25 to 35-40. In DSM-4, TR, intellectual disabilities are divided into a number of degrees of severity depending primarily on the range of IQ score provided by the sufferer. One of these is profound mental retardation represented by an IQ score below 20-25, 25-30, 15-20, or 10-15. Correct one is 20-25. Next question is in UK, the Special Education Needs and Disability Act of 2001 extended the rights of individuals with intellectual disabilities to be educated in mainstream schools. Schools are now required to draw up which of the following in order to facilitate the inclusion of pupils with intellectual disabilities and to make reasonable adjustments so that they are not disadvantaged. Inclusion strategies, facilitation strategies, accessibility strategies, or availability strategies. Correct one is accessibility strategies. Individuals with Down syndrome of 10 have moderate to severe intellectual impairment with a measurable IQ usually between 45 to 50, 55 to 60, 35 to 55, or 25 to 35. Correct answer is 35 to 55. Which of the following procedures can be used to identify Down syndrome prenatally? Omnicentrosis, omniprolasis, omniphalacissexy, omnicalcisis. Answer is omnicentrosis. Fragile X syndrome is associated with which of the following? Language impairment, behavior problems, moderate levels of intellectual disability, or all of the above? The correct answer is all of the above. Next question is, which of the following is an example of a perinatal cause of intellectual disability when there is a significant period without oxygen occurring during or immediately after delivery? Anoxia, pronoxia, anaphylacsia, or dysnoxia? Correct answer is anoxia. Which of the following is the main neurological birth syndrome caused by anoxia? Down syndrome, Fragile X syndrome, cerebral palsy, cerebral vascular. Correct answer is cerebral palsy. Stay blessed. See you in the next episode, that is part 3 of MCQs on mental retardation.